Cerebral palsy. What is it? Cerebral palsy is defined by the CDC as a group of disorders that affects a person's ability to move and maintain balance and posture. It's the most common motor disability in childhood. Cerebral means having to do with the brain. Palsy means weakness or problems with using the muscles. Cerebral palsy is caused by abnormal brain development or damage to the developing brain that affects a person's ability to control his or her muscles. Prevalency. Out of every 1,000 live births, we expect to see 2 to 4 children diagnosed with cerebral palsy. It's been found to be significantly lower among Hispanic populations compared to Black and white populations. Spastic cerebral palsy makes up 80% of diagnosed cases, and boys are 1.2 times more likely to have cerebral palsy than girls. Cerebral palsy is diagnosed in 3 primary ways. The first is developmental monitoring, which is also known as surveillance. This is done by tracking a child's growth and development over time. At each child office visit, the doctor monitors the child's development by asking parents if they have any concerns about their child's development, taking or updating the child's developmental history, and watching the child during the exam to see how he or she moves. It's important for doctors to monitor the development of all children, but especially those who are at higher risk for developmental problems due to preterm birth or low birth weight. If any concerns about the child's development are raised during monitoring, then a developmental screening test should be given as soon as possible. During developmental screening tests, a short test is given to see if the child has specific developmental delays, such as motor or movement delays. Some developmental screening tests are in the form of interviews or questionnaires completed by parents. Others are tests that the doctor gives to the child. The American Academy of Pediatrics recommends that all children be screened for developmental delays during regular well-child office visits at 9 months, 18 months, and 24 months. When a child is 9 months of age, many issues involving movement can be seen easily. However, mild movement delays that were not found in 9-month screening might be easier to see when the child is 18 months of age. By the time the child is 30 months of age, most movement delays can be found. The third way is developmental and medical evaluations. The goal of this is to diagnose a specific type of disorder that affects a child. To evaluate movement or motor delays, the doctor will look closely at the child's motor skills, muscle tone, reflexes, and posture, and take a careful medical history from the parents. The doctor will try to rule out other disorders that could cause similar problems. Because many children with cerebral palsy also have related developmental conditions such as intellectual disabilities, seizures, or vision, hearing, or speech problems, it is important to evaluate the child to find these disorders as well. The developmental evaluation can be performed by the primary care doctor or by specialists, such as developmental pediatricians, child neurologists, and pediatric psychiatrists. In addition to the developmental evaluation, additional tests can be done to look for a cause of the cerebral palsy. Specialists might suggest a CT scan, MRI, or EEG. Genetic testing or metabolic testing or a combination of these might also be done. Cerebral palsy is generally diagnosed during the first or second year after birth, but if a child's symptoms are mild, it can sometimes be difficult to make a diagnosis until the child is a few years older. These are the types of cerebral palsy. The first is spastic, which is the most common type and accounts for more than 3/4 of all cases. Most people with this type of cerebral palsy experience permanently tightened muscles or joints and jerky, exaggerated movement. The severity of the spastic cerebral palsy is classified based on how many limbs are affected. The ataxic cerebral palsy is rare. It accounts for just 2% of all cases. It affects the entire body and is noticeable due to involuntary and abnormal movements of the limbs and torso. It also affects coordination, balance, hand control, and precise body movements. Athetoid cerebral palsy is also called dyskinetic. It is slightly more prevalent than ataxic, accounting for about 3% of cases. This cerebral palsy causes involuntary movement in the face, limbs, and torso. It's a combination of the stiff muscles and loose muscles, making muscle tone fluctuate. Hypotonic cerebral palsy also accounts for about 3% of all cases. This type is characterized by loose muscle tone that causes loss of firmness and strength, lack of head control, and poor balance. Mixed cerebral palsy occurs when brain damage occurs in more than one area, and as a result, more than one type of cerebral palsy develops. About 15% of people with cerebral palsy have a mixed type. Any type of cerebral palsy can occur due to medical error, negligence, or malpractice. Asphyxiation is the most common cause of birth injuries that develops into cerebral palsy. Other cases of medical malpractice that may lead to cerebral palsy include failing to treat severe jaundice properly, failing to identify umbilical cord irregularities, and failing to detect fetal distress or the reduced heart rate of a baby in utero. These are just some general benefits of exercise. So we see increased musculoskeletal strength, increased cardiorespiratory endurance, just an increased overall quality of life. Spasticity in this regard means improved range of motion and muscle functioning. And then there's just an increase in general physical function, which includes functional mobility and improved gait performance. Cerebral palsy's effect on the exercise response. The primary impairments we see associated with this are reduced muscle strength, reduced cardiorespiratory endurance, reduced muscle control, fluctuating muscle tone, poor reflexes, poor posture, and poor balance. But this mostly depends on the area of the brain that is affected by the cerebral palsy. Many of these individuals experience limited range of motion, especially in individuals who suffer from the spastic type. And individuals who suffer from dyskinetic cerebral palsy may experience loss of voluntary control of muscles. So some just basic exercise modifications. The number one type is aquatic therapy, because this allows individuals to get in the water where they feel weightless, and they're able to focus more on their movement patterns and less about worrying about their balance and falling over. Passive range of motion stretching is encouraged over active. Exercise performed while seated are more important than free weight exercise. So we see these individuals typically use machines over free weights, and using games and fun activities may bring a better engagement from these individuals. Some medications here. These are just general medications for what the individual may take based on the severity. Anticholinergics are medications used to treat uncontrolled body movements such as muscle stiffness, tremors, and spasms, as well as drooling associated with non-spastic cerebral palsy. The result of this medication is temporary in large doses. Some of these medications can stimulate the nervous system. In small doses, the drug can act as a depressant. Common uses include treating spastic conditions in the digestive tract, reducing saliva, and decreasing bronchial secretions. The drug works by blocking the neurotransmitter that causes muscles to move. Excessive movement is often caused by excessive flexing of the muscle. Nerve impulses cause acetylcholine to be produced and travel across the gaps between nerves. When it binds to the second nerve, it fires, eventually stimulating the prospective muscle. This medication prevents the acetylcholine from binding to the second nerve, thus limiting muscle stimulation. Anticonvulsants, also known as seizure medications, are provided in hopes of reducing or preventing seizure activity. They also stabilize mood. They can reduce or depress excessive stimulation to the brain without affecting respiration or causing drowsiness. Antidepressants are psychiatric medications with mood-altering qualities used to treat depression, anxiety, and in some cases seizures. 1/3 of those with a chronic illness, such as cerebral palsy, may be depressed. Depression is a persistent sense of sadness, helplessness, and hopelessness. These following factors inherent in impairment may contribute to an individual's depression: perceived limitations, chronic pain levels, lack of control and coordination, dependence upon others, feelings of powerlessness, social isolation, and just overall poor quality of life. But not only are these individuals with the chronic medical condition at risk, but so are their caretakers. This is because of the stress they carry. For an individual with chronic medical conditions, the challenges they may have of day-to-day living with the added responsibilities, their feeling of helplessness and hopelessness and not being able to cure the person, the emotional toll of a child diagnosis and the lifelong realities of the condition, the potential financial burden, and just a sense of being overwhelmed. Antispastic, they're also known as muscle relaxants, and they're prescribed to relax contracted, overactive, or stiff muscles. These medications are often the first treatment choice of reducing tremors and controlling widespread spasticity, as they are easy to use and non-invasive. Antispastic can be administered orally, in tablet form or by injection directly into the affected muscle, or via a pump which is surgically implanted in the abdomen to deliver medication directly to the fluid that surrounds the spinal cord. Oral medications are usually prescribed for overall spasticity, while injections target a specific muscle group. Anti-inflammatories are also pain management. So Medscape reports 67 to 84% of individuals with cerebral palsy experience bothersome pain lasting 1 hour or longer per episode. Anti-inflammatories address pain by reducing or alleviating the inflammation. Stool softeners. Excuse me. Stool softeners help to maintain water content to prevent stool from becoming hard and painful. Various stimulants induce bowel contractions and move stool along the intestinal tract, allowing these individuals to go to the bathroom easier. Medication effects on the exercise response. So we may, these individuals with their medication may experience blurred vision and the preventing of muscle contractions. They may experience dizziness, headaches, and nausea. They may experience fatigue, blurred vision, and dizziness again, or they may experience laxity of muscles that prevent strong contractions and see an increase in intravascular pressure. For my case study, I decided to do it on a man named Frank, who's a 33-year-old man with spastic cerebral palsy. He's 5'7" and weighs 150 pounds. He has a BMI of 23.4 and a blood pressure of 124/74. His fasting blood glucose is 98 milligrams a deciliter and has a total cholesterol of 186. His LDL count is 136 and his HDL is 48. Excuse me. Frank has exercised in the past, but with the passing of his mother, he has not exercised in the last 6 months. This has caused Frank's ability to walk to regress, placing him back in a wheelchair to navigate outside his home. He suffers from periodic seizures and frequent bouts of depression. For his seizures, he takes gabapentin, and for his depression, he takes an antidepressant. Frank would like to get back into the shape he was in prior to his mother's passing. So the 3 exercise tests I would run Frank through. His first aerobic test, I would use the modified Bruce protocol test. For his muscular strength test, I would use a hand grip dynamometer. And for his flexibility test, I would perform the back saver sit and reach. His exercise prescription would look as follows. We would perform his aerobic activity 1 to 2 times per week, while we would progress to 3 times per week. We would work at an intensity between 50 and 90% of his VO2 max, with exercise bouts 20 to 30 minutes. We would perform biking, swimming, running, and dance. Excuse me. For a strength test, for a strength prescription, we would perform resistance training 2 to 4 non-consecutive days. The intensity would be 1 to 3 sets at 6 to 15 reps at 50 to 85% of his 1 rep max for exercise bouts of 45 to 60 minutes. We would start with single joint exercises that we would perform on machines, while we progress to less machines and more free weight multi-joint closed exercises. For his flexibility, because he has spastic cerebral palsy and that inherent muscle tightness and joint stiffness, we would want to be stretching 5 to 7 times a week with active and passive stretching. We would do this for 30 to 45 minutes, an exercise bout, and we would do every multi-joint muscle and major single joint muscles. Here are my references. My take-home message for this is that you just have a greater understanding of cerebral palsy, the disease process, and the treatment of it. By understanding this disease, we can better incorporate individuals who suffer from cerebral palsy into society. Thank you.